my privilege to introduce Dr. Rebecca Greiner, who is a physician assistant with the section of Integrative Oncology. She received her Ph.D. and a Ph.D. From Cornell University, and also completed training in integrative medicine from the University of Arizona. So, Rebecca, take it from there.
Thank you for the introduction, Dr. Amin. Can you hear me okay? Thank you. So good morning, everyone. I'm honored to be here with you today, and I want to thank the organizers for giving me this opportunity. And I'm glad that they rescheduled and that we were able to go ahead with the presentations. In this presentation, I'm going to first describe what integrative oncology is. And I work in the integrative oncology section at Levine Cancer Center in Charlotte, North Carolina. So I'm going to tell you a little bit about what that is and actually what it's not. And then I will go through some best self-care practices for melanoma patients. Next slide, please. So what is integrative oncology? Next slide. Integrative oncology is the combination of conventional cancer treatment with evidence-informed complementary therapies. Medical, radiation, and surgical oncologists treat your disease. We support these providers by assisting you in managing your symptoms from the treatment and the disease. We use research to guide our recommendations regarding eating patterns, physical activity, mind-body therapies, and occasionally some supplements. Next slide. More specifically, integrative oncology seeks to optimize health, quality of life, and clinical outcomes across the cancer care continuum, and to empower people to reduce risk of cancer and become active participants before, during, and beyond cancer treatment. Next slide. So what happens during a typical integrative oncology visit? Our visits are a bit different compared to other medical visits that you may have had. We start out by asking the patient, "Tell me your story." This statement means different things to different people. The patient may start their story at diagnosis or 20 years prior to diagnosis. We learn so much about what is important to each patient during this part of the visit. This is valuable information so we can help patients achieve their personal goals and aspirations. During the next part of the visit, we ask more specific questions about eating patterns, movement, sleep, sexual health, stressors, and other things. By asking these specific questions, we can determine what barriers are present which may prevent the patient from doing or being what is important to him or her, or what may be affecting patient quality of life and well-being. We also sometimes check blood levels of certain nutrients that, if abnormal, may affect quality of life. Once we have obtained a full history and received lab results, we work with each patient to develop an individualized plan to help them through treatment by managing symptoms and/or complications. Subsequently, we develop a risk reduction plan to help them reduce the risk of cancer returning, make healthy lifestyle changes, and improve their quality of life. Our work is patient-centered, and we depend on patients to tell us what they need so we can help them. Next slide. I'll give you an example. Some chemotherapy treatments can result in burning, tingling, and numbness in the hands and feet or other parts of the body. This is known as neuropathy. If the patient has concerns about neuropathy or is experiencing this symptom, we address neuropathy from a variety of angles. We will check blood levels of certain vitamins, such as B12, that if low can contribute to neuropathy. In addition, we will recommend acupuncture because research indicates acupuncture can lessen peripheral neuropathy symptoms. Not all patients are receptive to acupuncture, I'll admit that, so we may suggest physical therapy and in some cases, a supplement. Next slide. It's also important to discuss what integrative oncology is not. Integrative oncology does not involve alternative treatments, fad diets, or large amounts of supplements. It's our job to help you navigate the vast amount of information you may read on the internet and avoid harmful therapies. Some therapies you may read about on the internet may interact with your treatment and make it less effective. These alternative treatments have not been subjected to rigorous investigation by trained researchers. Next slide. Just a few more comments about supplements. We consider supplements to be like medications in many ways. Supplements are concentrated sources of nutrients or herbs and may interact with your treatment. Supplement manufacturers are not required to put all the ingredients on the label like medication or food labeling requirements. Therefore, anything could be added to these supplements, including unwanted hormones, dyes, preservatives, and fillers. In addition, supplements are not regulated. Therefore, it's important to tell your providers about every supplement you're taking and to ask before you take any supplements. Next slide. There's a hope that supplements can replace whole foods. How nice it would be to take some supplements in the morning and then eat what we would like to for the rest of the day. Unfortunately, this will not work. Whole foods contain the correct nutrients in the correct proportions and also provide so many beneficial compounds that have not even been discovered. Therefore, it's very important to learn to cook and enjoy whole foods to get optimal nutrition. There is a place for supplements, but they certainly cannot replace whole foods. Next slide. Now that I have mentioned what not to do, let's talk about the more exciting information and what you can do to help yourself. We will cover specific foods, some supplements, eating patterns. We'll talk about the microbiome, mind-body therapies, and how these things can help manage symptoms, improve quality of life, and well-being. Next slide. Garlic has been the subject of research with respect to cancer for a while. Garlic has components considered dietary phytochemicals, which can modulate activities within cells. Garlic compounds have been shown to reduce cancer-causing chemicals in cells and increase antioxidants, which protect cells. This article reports that a garlic extract can kill cells that are used to mimic melanoma cells. So it's very important to point out that this research is not done in humans, but on cells, and therefore the research does not mean that garlic can cure cancer. More research is needed to make those claims. Next slide. Additional research has shown that garlic and onions have constituents called organosulfur compounds that have anti-cancer effects on, again, just cancer cells. Again, this does not mean that these foods will cure melanoma. However, since there are no adverse effects to eating these foods, unless of course you're allergic or sensitive to them, we recommend that you increase your intake of whole garlic and onions. These foods can be eaten cooked and or raw to obtain the beneficial compounds. Next slide. We also recommend melanoma patients increase their intake of omega-3 fatty acids because these healthy fats may stop ultraviolet induced damage and stop growth of melanoma cells. Intake of omega-3 fatty acids may be associated with reduced incidence of melanoma, but more research is needed. We recommend that you increase your intake of foods with omega-3 fatty acid, such as salmon, ground flaxseed, and walnuts. It's important to note that you keep ground flaxseed and walnuts in the refrigerator or freezer to keep them fresh. In addition, do not take omega-3 fatty acid supplements unless you discuss this with your provider. Next slide. Foods with a nutrient called beta-carotene have been associated with a lower incidence of skin cancer in populational studies. Yellow and orange foods such as carrots, butternut squash, and peppers contain beta-carotene. Enjoy these foods raw or cooked and in a variety of forms, because some of the nutrients are absorbed more readily when the food is cooked. The addition of a little fat in the form of olive oil will also enhance absorption of some of the nutrients. It's important to note that supplements of beta-carotene and vitamin A have not shown benefit. Next slide. Intake of vitamin C from whole foods, such as citrus fruits, peppers, and leafy greens, is associated with lower rates of skin cancer. Leafy greens include lettuce, spinach, kale, mustard, and all other types of greens. Again, eat these foods raw and or cooked and use a small amount of olive oil to increase absorption of the nutrients. We don't recommend vitamin C supplementation because there is no research to support its use. Next slide. Resveratrol, a nutrient found in dark red and purple foods, has photoprotective effects against ultraviolet burns. The research is not definitive in humans, but adding these foods to your diet is not harmful and is likely to be beneficial. These foods include beets, eggplant, pomegranates, grapes, blueberries, etc. Just an aside about frozen food. I just want to let you know that frozen vegetables and fruits are a great option if fresh is not available. These foods are picked at the peak of ripeness and are frozen on site, so they retain all nutrients. So if you're not able to get fresh, frozen is a good option. Next slide. A compound in green tea has also been shown to have anti-cancer effects in animals. Large-scale definitive human studies are lacking, but green tea is safe and inexpensive, and you can start with about 1 to 2 cups daily. Some people say it has an acquired taste, but I think you'll get used to it. The tea can be hot or cold, but limit addition of sweeteners. Next slide. People with melanoma appear to have lower levels of vitamin D in their blood. There is a decreased risk of melanoma associated with higher vitamin D levels. Vitamin D is often added to dairy products and can also be obtained by spending time in the sunlight. It can be hard to get enough vitamin D through food and the sun. This is one case where a supplement may be useful. Ask your clinician about having your vitamin D level checked and if a supplement is appropriate for you. Next slide. Curcumin, found in the spice turmeric, helps reduce inflammation in the body and has been used safely as a spice and supplement for years. During treatment, obtain curcumin by using the turmeric spice and/or making a turmeric tea. And then after treatment, discuss the use of a high-quality supplement with your provider. You should not take turmeric if you're taking any type of blood thinner or have gallbladder problems. Next slide. Recent research in mice from the Nutrition and Metabolism Journal indicated that mice fed a high-fat diet had an increased growth in melanoma lesions compared to mice that consumed a normal diet. Furthermore, the addition of moderate exercise in the high-fat group slowed the melanoma growth, which returned to control levels. Although no human studies have been completed to confirm this research suggests that a high-fat diet and obesity may contribute to melanoma growth. Furthermore, the addition of moderate exercise may slow melanoma growth. Since other beneficial effects of exercise have been well studied and there are no adverse effects, we recommend adding moderate exercise, such as walking, to your routine by slowly increasing the time you exercise and varying the intensity. Next slide. Eating patterns can affect our health. People who report eating a Mediterranean-style diet, which provides an abundance of nutrients, tend to have less melanoma compared to people that eat the standard American-style diet. The Mediterranean-style diet of eating includes colorful vegetables and fruits, seafood, whole grains, olive oil, nuts and seeds, and reduced amounts of processed food, dairy, sugar, and meat. Next slide. The microbiome is a name given to the population of bacteria in our digestive tract. We are just learning that a healthy microbiome may actually enhance immunotherapy, although research is not conclusive. There are 2 steps to maintaining a healthy microbiome. First, consume fermented foods such as yogurt or sauerkraut as a source of the bacteria. Second, eat a high fiber diet from colorful vegetables and fruits to feed the bacteria. Research regarding the benefits of supplements containing probiotics is inconclusive in melanoma patients. Probiotic supplements may be recommended, but only for certain cases, so speak with your provider before starting a probiotic supplement. Next slide. Mind-body therapies such as acupuncture, healing touch, massage, yoga, etc., can provide relief of pain, stress, nausea, fatigue, constipation, and other side effects of melanoma and/or its treatment. These therapies are available at Levine Cancer Institute and elsewhere. Make sure to find a practitioner that is trained to work with cancer patients. Next slide. I want to say a few more words about healing touch, since many people may not have heard of this therapy. Energy systems affect overall health and quality of life. Healing touch practitioners are trained to use their hands to restore balance and harmony to the patient's energy field. The goal is to reinstate the natural flow of energy and is achieved by light touch or no touch. Restoration of the natural flow of energy can promote self-healing and improve quality of life. You can find out more about this therapy at healingtouchprogram.com. Next slide. Use sunscreen that is effective and safe for your skin. A trustworthy place to research safe sunscreens is the Environmental Working Group website, or EWG.org. This website will direct you to sunscreens without harmful chemicals and sunscreens that are effective in blocking the sun's harmful rays. This website also has information on a variety of other consumer products such as soaps, lotions, water filters, basically anything that you might want to know about. But I will warn you, it takes some time to wade through all this information. So I recommend approaching this website with a specific product in which you are interested. Next slide. In summary, eat lots of colorful vegetables and fruits, increase intake of omega-3 fatty acid foods, such as fish or walnuts, drink green tea, have your vitamin D checked and consider a supplement. Also consider a supplement of turmeric if you have completed treatment. Physical movement is important, as well as managing stress. Reference EWG.org for safe sunscreens. And consider Mindbody therapies to help with managing adverse effects, promoting self-healing, and improving quality of life. Next slide. So there's a handout here that I think all the registrants are supposed to be receiving, but if you would like a handout, you can let me know or the organizers, and I'll be happy to send you some. And with that, next slide. I want to thank you again for allowing me to be with you today.